One of the scariest moments is when you've just been the recipient of a breast cancer diagnosis. I know that because I'm a breast cancer survivor. I like to tell my patients, I'm in your corner. I'm one of the cheerleaders. And hopefully they see from me that a breast cancer diagnosis is not necessarily a death sentence. When a woman comes to get her annual mammogram, it's a nerve-wracking process.
This is a service that is really designed to make it easy and convenient and comfortable for women, providing great service, but also great care. But we really try and put women's minds at ease. And we treat people with a kindness that we would want ourselves to be treated.
What's nice about getting a mammogram at the Tully Center is we do provide same-day results. We do this real time. If a woman gets a mammogram, instead of going home and waiting for a week, she can wait in the waiting room and know momentarily if her exam was normal or if any additional images are needed.
Stamford Hospital has always been at the forefront of finding the latest and greatest technology.
We have what's called 3D tomosynthesis, sometimes called a 3D mammogram.
With 3D mammography, we find more cancers, we find cancers at a smaller, earlier stage, and we have many fewer false positives. That means we have fewer unnecessary biopsies, more accuracy.
Not only do we find more cancers, 3D tomosynthesis also allows us to know that certain findings are normal without taking additional images.
And our cancer detection rate is up 60% since we've been using tomosynthesis. Our cancers are smaller, and this is in a state with the highest rate of breast cancer in the country. Here, we really are a team. The care is comprehensive, it's coordinated, it's consolidated, and it has the patient at the center of it.
And I feel very lucky to work among a group of physicians that has an expertise in the field of breast imaging. This is all we do.
The Plaintree philosophy really does say that we're not specifically focusing just on a disease, we're focusing on the whole person.
The Plaintree approach really focuses on the patient as a human being, as an individual. We really customize our care to that patient and make them feel as though they're in a safe environment where people really care about them and are attentive to their needs.
That's very much the philosophy by which we try to practice medicine.
It bothers me when women don't come for their annual mammogram because they're afraid to find cancer.
Tens of thousands of women are living because of early detection.
This is not a disease that's just for high-risk women. This is a disease of women. And if you're a woman, it's so important. Get a mammogram every year. Go somewhere you trust.